treatment stacking seems to have become really, really on trend in 2025. However, as an aesthetic doctor, I've been doing treatment stacking for absolute years, actually probably since the beginning of my career in aesthetics. And that's because when we age, we don't age in just one way. We age from the outside in, so the skin loses elasticity, we lose collagen, we don't have as much HA in the skin, so the skin is a little bit saggier, it's a little bit wrinkled, and it is a little bit thinner. Underneath the skin, we've got what we call subcutaneous fat pads. That's the fat you can pinch. These fat pads will often change. Some of them grow, some of them shrink, but actually most of them begin to slide down the face. And that's because they're normally held up, our tissues are held up by retaining ligaments. And these retaining ligaments are also made of collagen, and they slacken over time. Underneath the subcutaneous fat pads, we've got muscles. Some of our muscles, the ones we use the most, like the angry muscles, they get shorter and fatter and they become stronger, just like if you're a bodybuilder and you're working out your biceps. The muscles we don't use quite as often, they become long and slack and saggy. The deep fat pads that exist under the muscles but just above the bone are there to fill our face out and give it some support, and we lose 1% a year in volume in those fat pads after the age of 25. It's the same with our bone, so the skull that we have and the mandible, so that's the jawbone. Again, we're losing 1% a year in mass, so that's in weight, after the age of 25. That's on average. What does that mean? That means the skull is shrinking, so we've got less support. The deep fat pads are shrinking, so we've got less support. And then everything is sagging and sliding downwards, and then the skin is long and floppy. So if we're reversing the signs of aging, we've got to work on all the different layers. That means we need skin treatments for the skin. These will be collagen stimulating treatments such as Lanluma, Elancé, Sculptra, Dulane, Harmonica, or needling radiofrequency treatments. Underneath that, we may need filler to replace lost volume, or even threads to lift and reposition the subcutaneous fatty tissues. Beneath that, we've got the muscles. So overactive muscles might need an anti-wrinkle injection to help them to relax and soften. Below that, we've got the deep fat pads in the bone. And actually, the only way to replace lost volume is with volume, and that is using a filler, either an HA filler or a collagen stimulating filler. But that's the way that treatment stacking should work. So when we want to provide a holistic treatment, we often have to harness more than one modality to get the result that we need.